member for Kingston and the Islands.
Mr. Speaker, when family medicine students do their rotations and reach the end of residency, that experience scares them away from being Ontario family doctors. In this Premier's Ontario, they joke that they're looking for a, quote, exit strategy. One resident I spoke to said that 80% of their circle are instead going into sports medicine or other specialties. One is doing an optional rotation to check out British Columbia, where the government treats family doctors better, like for their time spent on administrative work. No wonder 2.5 million Ontarians don't have a family doctor. Does the Premier of Ontario, who has 32,000 people in his riding without a family doctor, including 5,700 children, does he really understand why family medicine residents are looking for an exit strategy?
The Deputy Premier and Minister of Health.
Perhaps the member opposite, who is a member of the Ontario Medical Association, can explain how we are actively working with the OMA on some pilot projects, including Dr. Scribe, that ensures that physicians have more time to have face-to-face interactions with their patients and less in front of the computer. But I have to say, you know, in the province of Ontario, for 2 years running, we have had 100% matching of CARMs. That's pediatricians. That every single specialty has been matched in the province of Ontario with a residency student and their preferred match. I think we're doing just fine in terms of physicians and students who want to practice in the province of Ontario as we expand the opportunities here in Ontario.
Supplementary.
Well, Speaker, I'm having dinner with some residents soon. I'll just tell them that the minister thinks everything's just fine. Some constituents in Kingston and the Islands travel to Oshawa, Ottawa, Markham, and even Brampton and Mississauga to see their family doctors. They're afraid to get on this government's waitlist for a local doctor, Healthcare Connect, because they first have to give up their family doctor in exchange for years of uncertainty. Even worse, many unattached people don't even know about Healthcare Connect. I've checked a couple of ways, and something like 1 out of 3 people without family doctors don't know about this lifeline. Why can't the Premier use the millions of dollars spent on feel-good vanity ads to instead make sure people without a family doctor, like 100,000 folks in Etobicoke, make sure they know about the basic waiting list for family doctors?
Order. The Minister of Health.
You know, as I see expansions that are happening, including in your own community in Kingston, where we have expanded primary care expansion. You know, last week, Speaker, I was in Innisfil. And in Innisfil, we've now opened a primary care practitioner, nurse practitioner-led clinic. And we have 10 nurse practitioners who are now practicing in an expanded clinic in Innisfil. Those are the expansions that we are doing. Of course, there is Periwinkle in Kingston, and we have 78 other examples of those primary care expansions. But I have to remind the member opposite that it was actually a Liberal government that cut the number of seats available for physicians. The number of students who couldn't learn and practice in the province of Ontario because of a cut of 50 every year. That's 350 physicians, Speaker, who weren't able to train in the province.
Thank you.